A common bile duct stricture occurs as a complication of chronic pancreatitis in 3 to 23% of cases. The clinical presentation ranges from incidental findings to severe jaundice and cholangitis. A small proportion of patients may develop secondary biliary cirrhosis. The European Society of Gastrointestinal Endoscopy recommends treating chronic pancreatitis-related common bile duct strictures in case of symptoms, secondary biliary cirrhosis, bile duct stones, progression of biliary stricture, or when eutectic cholestasis, a serum alkaline phosphatase level greater than twice the upper limit, persists for more than 1 month. When a common bile duct stricture caused by chronic pancreatitis has been treated endoscopically using a single biliary plastic stent, the long-term success has been disappointing. Stenting with multiple plastic stents has led to success in 60 to 92% of cases. The use of uncovered self-expandable metallic stents in benign biliary strictures is not recommended because of removal problems caused by embedding. If endoscopic treatment is selected, the European Society of Gastrointestinal Endoscopy recommends temporary placement of multiple plastic stents. A removable covered self-expandable metallic stent is a particularly intriguing option for treatment of benign biliary structures, as a 10 mm self-expandable metallic stent corresponds to a common bile duct diameter achieved by 6 or 7 10 French plastic stents. In their prospective randomized study, Carola, Haapamäki et al. Aim to compare the safety and feasibility of covered self-expandable metallic stent with multiple plastic stents in the treatment of biliary stricture caused by chronic pancreatitis with or without an acute component. Their results are reported in their paper entitled Randomized Multicenter Study of Multiple Plastic Stents versus Covered Self-Expandable Metallic Stent in the Treatment of Biliary Stricture in Chronic Pancreatitis. Here is a summary of their findings. Background and study aims. The use of covered self-expandable metallic stents in benign biliary indications is evolving. The aim of this study was to assess the safety and feasibility of covered self-expandable metallic stents compared with multiple plastic stents in the treatment of benign biliary strictures caused by chronic pancreatitis. Patients and methods. This was a prospective multicenter randomized study of 60 patients with benign biliary strictures caused by chronic pancreatitis. All patients received an initial plastic stent before randomization. At randomization, the stent was replaced either with a single covered self-expandable metallic stent or 3 plastic stents. After 3 months, the position of the covered self-expandable metallic stent was checked, or another 3 plastic stents were added. At 6 months after randomization, all stents were removed. Clinical follow-up, including abdominal ultrasound and laboratory tests, were performed at 6 months and 2 years after stent removal. Results. 2 patients dropped out of the covered self-expandable metallic stent group before stent removal. In April 2014, the median follow-up was 40 months, range 1 to 66 months. The 2-year stricture-free success rate was 90% in the covered self-expandable metallic stent group. There was 1 late recurrence in the plastic stent group 50 months after stent removal. Stent migration occurred 3 times in the plastic stent group and twice in the covered self-expandable metallic stent group. Conclusion. A 6-month treatment with either 6 10 French plastic stents or with 1 10 mm covered self-expandable metallic stent produced good long-term relief of biliary stricture caused by chronic pancreatitis.